forward to today's focus. I'm going to give a case presentation for a patient with myelofibrosis. Now, this is a 58-year-old that previously had polycythemia vera with a lot of red blood cells for many years, 6 years, and they were doing great. But recently, they had new symptoms, including weight loss, night sweats, and abdominal pain with difficulty finishing their meals. On physical exam, we were able to palpate their spleen on the left side of the abdomen at very large, 20 centimeters below the left costal margin of the ribs. Their blood counts showed that they have a new anemia with a hemoglobin 9.9 and a new thrombocytopenia with platelets in 76. Again, we found the JAK2 mutation, and the gold standard to figure out what's going on at this point is a bone marrow biopsy. And with that, we diagnosed the patient with post-PV myelofibrosis. So myelofibrosis, the main diagnostic criteria, as I mentioned, includes a couple things. Number one, bone marrow biopsies are key and very, very necessary. We would give a patient's bone marrow biopsy to a hematopathologist to expertly look under a microscope for key features, including atypical or abnormal features within a very specific cell called the megakaryocyte. That's number one. We also want to see if they have a lot of this network for fibrosis, with grade 2 and 3 being the largest amount of fibrosis. That's the first major criteria. And as I mentioned before, we need to find the JAK2 CALR MPL mutation, and we want to make sure that they don't have any other blood cancers such as CML or acute leukemia. So how do patients present? I briefly alluded to it in the case presentation, but patients typically have quite large spleens, and that causes the majority of the symptoms. Patients can have abdominal pain, bloating, and fullness that leads to early satiety where they can't finish their meals. They can have portal hypertension and acute pain in their left side due to infarction from the spleen because it's growing so rapidly. Due to the fibrosis buildup in their bone marrow biopsy, they would see that there's not enough room for blood cells to be made, and they would have low platelets and low hemoglobin and maybe even low white blood cells. Due to the ongoing activation of the pathway that's important, there's cytokines that are released and a lot of inflammation. And patients present that with fatigue, night sweats, weight loss, and even bone pain.